Good morning, this is Dr. Tyler Hamel, Kingwood chiropractor and nutritionist. Happy Monday to everybody out there. Today, going to talk about a very important subject on the subject of recovery. So lots of patients who are coming in, neck pain, back pain, headache, sciatica, that's mostly what we see. And it's usually of a chronic nature, meaning that it's been going on for more than 3 weeks, sometimes 3 months, 3 years, and even longer than that. So when we look at that, I mean, there's a couple things, right? First of all, we want to know, well, why is that happening? Why isn't the body able to heal and repair? And there's many different things that can play a part with that, right? Spinal interference or issues in the spine can cause problems with healing and repair. That's definitely one. Nutrition's another thing. If you're not getting the right nutrition into your body, which helps with heal and repair, it might not be able to do that either. But lastly, recovery is based a lot on sleep and sleep habits, right? So if we are go, and in this stressful type of world, which we're in right now, and working and exercising and working out, and we have a lot of postural stress, if we're not getting enough sleep, then that makes it really, really hard to recover the next day. That's why today we see all these fancy things to measure our sleep, like deep sleep, REM sleep, how many times we're tossing and turning in the night. We have watches that do that, other devices that do that, rings that do that, even beds now, I think, that can measure your REM and your deep sleep. So this is a big deal, right? Like if we could go to bed and get some really good deep sleep and REM sleep, we would wake up refreshed, and that's a part of the recovery process. So what I've seen in the past, sometimes people trying to do everything right. They're doing the chiropractic or the physical therapy or massage, acupuncture, things like that. But they're not able to get enough rest at night, right? Like, oh man, I can't go to bed at night. I stay up till midnight. I wake up at 5. For a busy person, a busy day, lots of postural stress, somebody who works out, that's not enough rest. It just isn't. There isn't a way to make that work. So some things that you can do just to improve your sleep. So number one, you've heard it before, but shut off all screens like an hour before you go to bed. Number two, don't eat anything really close to going to bed because that can mess with your blood sugar and that could wake you up or prevent you from sleeping. Number three, don't drink a bunch of water before you go to bed. And number four, you can take certain supplements to help calm down the nervous system or calm down your body before you go to bed. So what are the things that we use? Magnesium. We all know magnesium lactate in this case, very good at just calming the body down. So you can take 1 or 2 of those about an hour before going to bed. If you have headaches and you need magnesium, migraine headaches especially, you can take Easy Bag. This is a vegetarian form of magnesium, crosses the blood-brain barrier, and it's really, really good for headaches. So you can take 5 or even 6 of those about an hour before going to bed. And also we have something called adrenotrophin, which is something that helps support the adrenal glands, right? When we hear about adrenal fatigue, adrenal burnout, we always think tired. Sometimes people with adrenals that are not working well, they're super tired. They lay down at bed at night and they just can't fall asleep, right? There's something that mixed up or reversed there. So take 2 adrenotrophin and then 1 or 2 magnesium about an hour before you go to bed. Lots of times that can help do the trick. So talking about recovery today, Dr. Tyler Hamel, I'm a chiropractor nutritionist. I always look at it as far as aches and pains. Like if you're not recovering, it's hard to feel better. So take that note and try these things out. We have them in stock in our office. You can always call 281-360-8387. Y'all have a great Monday out there. I'll snap a picture of these supplements and put it in the post below so you can see what they look like. Give us a call at any time. We'll do our best to help you out to answer any questions. Again, 281-360-8387. See you soon.